My name is Scott Leadingham here in the unique Northwest. I am joined by Austin Jenkins, Olympia correspondent for the Northwest News Network. Thank you for joining us today, Austin.
It's great to be here. Scott, thanks for having me.
Today we are talking with Austin about a big 5-part series that he just wrapped up involving patients from Washington State with brain injuries who were sent to Oklahoma and how that interaction played out. It's a fascinating story. Austin's going to tell us all about it. Also, he's going to preview some of the races in Washington State to watch ahead of the upcoming primary and the general election upcoming in November. So to jump right in, if you have any questions along those topics or any others that Austin covers here in the unique Northwest, ask those in the comments section on Facebook and we'll try to get to them now or after the live stream. So Austin, first, this big case that you were looking at for many months, frankly, and it just came out last week in a 5-part series on radio. Big web story coming up to accompany that. Tell us about these patients from Washington State and how they ended up in Oklahoma.
Well, this really is one of those untold stories of state government as part of why we have a public radio statehouse reporter full-time in Olympia, because part of my job when the legislature isn't in session is to be finding out what the state agencies are doing and what they're not doing and how they're spending money and how they're caring for some of the most vulnerable people in our state of 7 million people. And what's fascinating in the context of this, Scott, is that we are a very advanced state. Technologically, we're advanced from a healthcare delivery standpoint. But here we had a subset of brain injury patients who had very complex behaviors that accompanied their brain injuries. And there was nowhere to care for them. They were either bouncing in and out of adult family homes or group homes, or they were stuck in psychiatric wards. And in a desperate moment to try to find an appropriate setting for these individuals, the state signed a contract with a neurologic rehabilitation facility in Tulsa, Oklahoma called Brookhaven Hospital. And once that contract was signed and once the word got out, patients started going there. They were flown aboard air medical flights for about $230,000 per flight. One of the people to go was Lori Jenks, who's in this photograph here, pictured with her husband in 2010, August. They were attending a wedding near Walla Walla. About 30 minutes after this photograph was taken, they were in a head-on car crash, and Lori, who was described as the social organizer of their family and somebody who showed Weimaraners and won competitions with her dog in these obedience competitions, she was forever altered. Severe brain injury, very different personality. And she's one of the patients that went to Brookhaven. You were seeing a picture of that building in Tulsa. All told, 16 patients from Washington were sent there. And what's remarkable here, Scott, is that some of them stayed for years. There was no plan, it turned out, to bring them home. And mind you, this was hospital-level care at $1,000 a day as compared to $200 a day for a long-term nursing facility. Another patient who went is pictured here, Nadia Ibrahim. She was 22. This is her mom, Regina, a recent photograph from Western State Hospital where Nadia is currently a patient. But Nadia, too, is at Brookhaven and spent a couple of years there, very difficult to manage behaviors. And she comes back to Washington eventually. And where does she end up? Back at Western State Hospital, which is the state's largest mental facility, not where her mom thinks she belongs.
Okay, so Austin, these patients, it's not really fair to say they were forgotten about, but the state of Washington maybe took longer than they were expected to in bringing them back. Some people are still there. So is it fair to say, though, that this might have been a case of just the left hand not really knowing what the right hand was doing in some cases? That happens in bureaucracies. And for that matter, who's the left hand, who's the right hand in this case?
Well, it's the healthcare authority, which runs the Medicaid program, is the entity that signed the contract with Brookhaven back in about 2013, 2014, and started authorizing patients to go there. What's important about that is that the Medicaid program authorizes payments to providers, but it doesn't do case management. So while it organized and authorized these patients to go and got them there aboard these expensive flights, and got monthly reports back from Brookhaven, they didn't really have a mechanism to do much with those monthly reports or to actively oversee the care and plan for the eventual return to Washington for these patients. In essence, there was no exit strategy, to use a military term. The other agency that comes into play here, the right hand, if you will, is the Department of Social and Health Services, which does do case management. It also does long-term care, whereas Healthcare Authority and Medicaid do short-term hospitalizations. But the Department of Social and Health Services doesn't do case management for people who are outside the boundaries of the state of Washington. So in that sense, these patients slipped between the cracks of two agencies. And it wasn't until they both got together and started talking last year, about a year ago this time, that they started to formulate a plan, an airlift, if you will, to start bringing these patients back.
So then, not to cast aspersions on anyone or any particular department, but if there's maybe a dart to throw in this case to say, okay, this facility or this agency might have done better, who gets the dart? And if there's a laurel to be awarded for good work in the end, who gets the laurel?
Certainly, you could argue that the dart goes to the Healthcare Authority and the Medicaid program. They didn't do this out of any ill will. In fact, they were looking for a solution for these patients who were extremely hard to place and arguably did need a higher level of care, and in fact, very likely needed rehabilitative care. The idea that the state Medicaid program would pay for several months of very expensive care is actually beyond what many private insurance companies would do. And what I've heard as I've researched this is that a lot of the private companies, private insurance carriers have driven down the number of days you can even qualify for hospital level care post brain injury, such that people aren't getting optimal levels of hospitalization. That said, clearly they should have managed this better. Clearly they should have had an exit strategy. And what even their own internal doctors at the Healthcare Authority will say is this went on way beyond what you could justify for acute level or subacute level hospitalization. This turned into long-term care. The laurel, if you will, the award probably goes to a woman named Betsy Jansen of the Department of Social and Health Services, who has almost single-handedly worked to bring these patients home and find a placement for each of these patients. Not necessarily the perfect placement, but looking for a way to get them back, get them settled. 4 of them are actually in an adult family home in the Spokane area. 3 still remain, however, to this day at Brookhaven Hospital in Tulsa, Oklahoma.
So, big web story coming from you on that after your 5-part radio series. I know that's going to be posting soon to nwpb.org, so look for that. So, Austin, moving along to the politics season. It's always politics season, but election season coming up here in Washington State. We have the primary on August 7th, and then, of course, the general election in November. What are some of the big races that you're following, the ballot measures that are on your radar as a reporter there in Olympia?
Well, in the short term, looking to the August primary, and the primary participation is very low. I think most political watchers will say that August is not a great month to be doing a primary because people tend to be in summer mode. They're on vacation and they're not thinking necessarily about elections. And yet this is the point at which we winnow the candidates down to the top 2. And remember, we have this kind of unique top 2 primary system where the top 2 vote getters advance to November, even if they are from the same party. And we have actually seen that play out in not a few races over the last few years since we adopted this. But watching the primary ballot, certainly we have a U.S. Senate race with U.S. Senator Maria Cantwell up for re-election. There is a long field of candidates vying in that race. Probably the most prominent Republican is Susan Hutchinson. She is most recently the former chair of the Washington State Republican Party. Previously, she was anchorwoman at Cairo TV in Seattle, so has some notoriety certainly on the west side. But when you look at your ballot, you're going to be amazed at the number of candidates running in that race. There are also a number of legislative races up. So all House members and about half the state Senate is up. What's interesting is if you look at state legislative races, many of those candidates run unopposed. You'll see cases where there's just one name. Oftentimes you'll see incumbents not being vigorously challenged. And beyond that, there's going to be a number of judicial races on your ballot as well. And those are hard for voters. And that's probably where, if there's advice to the voter, start to do your homework on some of the judicial races, because obviously they're not advertising a lot. You're not seeing TV ads. And these are names that are not household names. So it requires a little bit of research to figure out who these candidates are.
Yes. So, Austin, you cover the state legislature day in, day out when the legislators legislature is in session, and then state government more broadly throughout the year. Make the case for why people should pay attention to those state and local issues, aside from those big national races or the big races for Congress or Senate that we think about. Here on the east side of Washington, where we are, big race with Cathy McMorris Rodgers and Lisa Brown, of course, in the 5th Congressional District. That's a big one there. But on the state and local level, make the case for why people should be more informed and pay closer attention to those races.
Well, and we were talking about the primary, but looking ahead to November, we're going to have, it looks like, 3 ballot measures, voter initiatives on the ballot, including a carbon pricing initiative. We saw one a couple of years ago. This idea is back now in a different form. In fact, I think the last one was just last year. We're going to have another quote-unquote, advocates would say gun safety measure. Opponents would say, gun restriction measure, but having to do with so-called assault weapons or semi-automatic rifles, raising the age restriction on purchasing those, waiting period, and also some requirements around, quote, safe storage of guns. That's likely to be on the ballot, as well as a prohibition on Seattle-style soda taxes, this one backed by the soda pop makers. So you've got statewide ballot measures, and then you've got all of these legislative races. And to your point, we look at Congress, it gets a lot of attention, but obviously not a lot happens in Congress. There's a lot of gridlock there. Meanwhile, here at the state level, at the state legislature, a lot happens, even when there's divided control. A remarkable amount of legislation gets through the state houses. And that's absolutely true in Washington state. We are still in very tight, narrow control of both chambers. And so there's always the potential for, in this case, Republicans to take back control of a chamber during this race. So the stakes are high, the issues are important, and your state legislature is actually passing legislation at a rate that far surpasses what the U.S. Congress is doing.
Okay, so honing in on one of those state legislative races, the issue of sexual harassment within the legislature has been big this year, and rightfully so, of course. And one legislator in particular, David Sawyer from Tacoma, has been kind of embattled with some of his actions and stripped of some committee chairmanships, and he's decided to run for re-election despite calls for him not to. And talk about the implications for that race with Democrat David Sawyer.
We'll certainly be watching the primary results to see if he makes it through the primary. He faces a challenge from a fellow Democrat who has gotten a lot of support from those who have abandoned support of David Sawyer in light of these developments and the stories about him and the sanctions against him. So there is a Democrat running to challenge him. He is a Democrat too. Whether they both get through the primary or he does and a Republican challenger, or potentially he doesn't, and this Democrat is challenging him along with a Republican. It'll just be interesting to see what the results are. We're already seeing some of the women who have accused him of inappropriate behavior have teamed up. They've started a political action committee. They're getting some funding from some big name donors and getting out publicly to talk about why voters should not vote for him. At the same time, we're seeing some of his longtime supporters stick with him. So we'll be watching to see what the results are. And this isn't, in a way, Scott, I think you sort of, the reason why you wanted to highlight this is perhaps the first test here in Washington at the ballot box of the impacts of the Me Too movement and the reporting on public officials, state lawmakers in that context. How will voters respond to that? I should note that State Representative Matt Manweller is also up for re-election this year. He's also been in the news, and we're awaiting a report from Central Washington University that was investigating allegations around his conduct there as well. That report hasn't come out yet, but 2 candidates on the ballot have certainly been in the news because of allegations about their treatment and conduct towards women.
Matt Manweller, who I should note was my political science professor at Central when I was a student there. So real quickly, Austin, very hot out there as we end up here. Lots of water bodies over there in Olympia where you are. How are you staying cool? And you can't say you're going to the pool because that's a lame way to get cooled off. How are you staying cool? Not
going to the pool. So jumping in Puget Sound, even though it's very cold, but I am a avowed Puget Sound swimmer, especially on a 90-plus degree day. And my wife has a whole theory about keeping the house closed, which is kind of antithetical to mine, which is you want to open up the doors and open up the windows during these nice warm, sunny summer days. Her view is no, you close the shades, close the house down after about 7 or 8 in the morning, and try to keep it cool into the evening. And I would say it actually works pretty well. So the front door was open early this morning, but it's now locked, shades are down, and we're trying to keep the house cool.
All right, keep us informed about that battle within the Jenkins household. Austin Jenkins, thank you so much for joining us today.
You're welcome. Thanks for having me.
Read all of Austin's reporting at nwpb.org or join us every Tuesday at noon here on Facebook, where we talk about news here in the unique Northwest.